I saw a video of yours, a bunch of videos. I did some research on you. You had this one patient of yours who they interviewed, and she was in awe. She's like, I don't know, she was having some issues. Forgive me on the details, but and she said, like you said, you treated her and it was instant, and she was in awe of you. How did that make you feel?
Yeah, it's actually that's what drives me on a day-to-day basis because you know there's only a certain amount you can push your body and do the work, but you know that gratification that you get once you see these patients and it really drives you
It
to
drives
go
you.
more, go that extra step, get the best outcome. You know, every day we're dealing with new conditions and the challenges every day in procedures. Like yesterday, I did about 3 or 4 surgeries, and one of them was really complicated. But you know, thriving for that best outcome, which gets you, you know, going and give that extra 200%. I think that, and then when they come back and they feel great, it's really makes it worth the effort.
Your typical day. What's your typical routine?
Yeah, I start early, so I'll always start with some degree of meditation in the morning, and then I try to get a workout in for even if it's for 15, 20 minutes. I just want to get the metabolism up, and then some days it's my duty to drop the kids off to school, so I really enjoy that.
Yeah,
Otherwise, work.
yeah.
And then 2 or 3 days a week I am operating. Other days I'm in office. Some days I'm traveling for meetings or proctoring or teaching or
Speaking on stage.
speaking on stages and conferences. And also we work a lot in cadaver and models to develop new technology. So that takes a little bit of the time. So it's well balanced out throughout the year. And
Yeah.
then try to be later on the home. I try to um, get another workout in towards the evening, which is a little bit longer. So just to tone down a little bit.
Sure.
And then the intention is to keep the blood flowing and disconnect from the rest of the day. So
What was one of the most intense cases you had?
intense. So there's so many.
Top of your mind comes
Uh,
up.
for us, I think the sickest patients that we see are the ones who are having dangerous rhythm problems from the bottom chamber of the heart, which is known as cardiac arrest. There are several cases like this where they're almost having refractory cardiac arrest, where they need to be shocked every minute or so. So typically we have to go inside and put some sort of support to support their heart, and then we create like a map of the heart to identify those channels which is causing the heart to go crazy and fast, and then we apply heat energy to those. So I've done several of those. One of them I actually remember several years ago. We had to open the lab on a Sunday, and the team came in, and which is rather unusual for us to do this on a weekend. These kind of complex cases, and we were there till 1 a.m. doing this. So quite a few of these.
I mean, I see we've have enjoyed parties together. You're like me. You like to be, in the center and having fun. Whenever I saw you, you're always happy,
Mm.
happy go lucky. And the other day we had a nice dinner side by side, and you share a lot of gratitude,
Yeah.
a lot of gratitude on different little things that I have observed closely. Have you always been like this, like gratitude?
Yeah, I think because I'm seeing so much pain around us on a day-to-day basis. People that you're going through. If you don't appreciate what you have,
Mm.
um, I think it's just unfair. So I think a lot of what drives us these days, especially, is just looking at other people and envying them. But I think if you just look around the pain that there is and suffering there is, and then appreciate what you have, I think you
It's better.
much
It
better
centers you.
happiness. Yeah.
Are you familiar, Dr. Ziki, with the phrase law of attraction? What you think about, you bring about.
Yes.
You
Yeah.
believe it?
Yeah. I mean, I think all of us carry energy around us, and that energy interaction has to happen.
Mm.
I see that on a daily basis with patients too. I mean, the way I am with my hair tied and like this, I go in and see a patient. Often I'm not wearing any suit and I'm in scrubs or maybe sometimes even jeans, and patients see it because I speak to them from my heart, and I'm very honest with them about what I'm able to do and when I'm not able to do. And imagine yourself coming in as a patient and having someone operate on your heart, and a lot of times it's that energy which drives that decision making and that decision that patient makes to
Yeah.
undergo that surgery.
I shared my story with you, my stroke story, and so the person who did my procedure, he was my age. He was 35, and he came to see me the week after when I came out of my coma. He had a Hugo Boss shirt on and a bandana on, and I couldn't believe that's my doctor. But it made me feel relatable to him.
Yeah.
Because
Yeah.
most of the time when we think of doctor, we see glasses, we see, short
Nerdy
hair.
look, yeah.
Yes.